Have you ever actually stopped to wonder how we can measure the sustainability of a health insurance company? When we think about corporate sustainability, our minds usually jump straight to, I don't know, carbon footprints, solar panels, or electric vehicles. But what about the companies that literally manage our healthcare? How on earth do you measure the social and environmental resilience of an industry that deals in human lives, massive, complex provider networks, and, frankly, vast amounts of highly sensitive data? Well, welcome to this explainer because we are going to unpack exactly that. We're going to break down the anatomy of a sustainable health plan by looking at the authoritative rulebook used by investors and regulators all around the world.
To really understand this, we first need to look at how businesses are categorized when it comes to sustainability reporting. It's done using something called the Sustainable Industry Classification System, or SICS for short. It's basically a framework designed to group companies based on their shared sustainability risks and opportunities. And under this system, the managed care industry isn't just lumped in with general finance or some abstract insurance category. No, it is specifically categorized under the healthcare sector, uniquely identified by the code HCMC. And this classification is absolutely crucial because it acknowledges that managed care entities face very specific, highly unique challenges that demand tailored, industry-specific measurement.
Okay, let's dive into this. The specific standards we're looking at today were originally developed by SASB, which is now under the stewardship of the International Sustainability Standards Board, or ISSB. This document is essentially our trusted map for today's explainer. It mandates exactly what these managed care entities need to disclose to prove they're operating sustainably and managing long-term risks. It totally moves the conversation away from vague, feel-good promises and forces these companies to report on cold, hard, trackable metrics. To make sense of this massive accounting standard, we're going to funnel it down into 5 digestible pillars. 1. Decoding SICS code HCMA. 2. Protecting customer health data. 3. Access and plan performance. 4. Improving patient health outcomes. And 5. Climate change health impacts. Let's get into it.
Section 1. Decoding SICS code HCMC, the DNA of managed care sustainability.
So, what exactly falls under this managed care umbrella? According to the standard, these entities offer health insurance products across the board. We're talking individuals, commercial groups, and government programs like Medicare and Medicaid. They also provide administrative services for self-funded plans, and they manage pharmacy benefits. But the really important takeaway here is how their business model actually operates. While their enrollment numbers traditionally correlate with employment rates, their revenue and their margins are uniquely driven by medical cost inflation. Because of constant legislative uncertainty and intense everyday pressure to reduce healthcare costs, their long-term survival, their true sustainability, is increasingly dependent on one core thing: patient outcomes. Ultimately, if patients aren't healthy, the business model just isn't sustainable.
Section 2. Protecting customer health data, customer privacy, and technology standards.
Now, before a company can even begin to think about health outcomes, they have to manage the absolutely massive responsibility of protecting our data. Ask yourself, what actually happens when your personal health data is compromised? We aren't just talking about a stolen credit card number that you can easily cancel. The standard heavily emphasizes that healthcare companies collect deeply sensitive data, and a failure to develop strict administrative, physical, and technical safeguards can lead to incredibly severe civil and criminal penalties. And with cyber attacks targeting the healthcare sector literally skyrocketing, this isn't just some hypothetical risk, it is a daily operational threat that directly impacts an entity's financial stability. So the crucial point here is how the standard actually forces companies to report on this. They can't just put out a PR statement saying, "We take security seriously." No way. Under metric HCMC-230A.2, they must disclose exactly 3 specific things regarding data breaches. First, the total number of data breaches. Second, the percentage of those breaches that involve general personal data versus the percentage that involved highly sensitive personal health data. And third, the exact number of unique customers affected in each of those categories. This level of granular transparency shows investors exactly how vulnerable a company's data infrastructure truly is.
And to put a real quantifiable financial price tag on this risk, the standard requires another critical disclosure: total monetary losses. Entities have to report the exact financial hit they've taken as a direct result of legal proceedings associated with data security and privacy. This includes the whole shebang: civil judgments, regulatory penalties, fines, and restitution. It completely strips away the corporate spin and reveals the direct, bottom-line cost of failing to protect patient privacy. Section 3, Access and Plan Performance. Translating premiums to care. Okay, it's one thing to collect insurance premiums securely, but how well are these plans actually performing for the people who are paying for them? The medical loss ratio brilliantly illustrates the core of healthcare economics. The standard requires entities to disclose the percentage of their total healthcare insurance premiums that are spent directly on paying medical claims, plus the money spent on efforts to actually improve the quality of care. It's a direct comparison against the total premiums they've collected. Basically, it asks, out of every single dollar you pay in premiums, how many cents are actually going toward patient care and patient safety programs, rather than, say, administrative overhead or corporate profit. This is a massive indicator of both regulatory compliance and social value. Now, what's really interesting about this slide is how the framework measures the everyday friction between the insurance company and the patient. Companies are strictly required to report their enrollee grievance rate, which literally measures the volume of complaints from members who are unhappy with their access to care or timeliness. Even more telling, they must report the percentage of claims that were initially denied, then appealed by the customer, and ultimately reversed. Think about that for a second. If a health plan has a high rate of reverse denials, it heavily signals a potentially systematic issue of wrongly denying valid medical care upfront, which is a major reputational and regulatory risk. They also must report their enrollee retention rate, proving whether customers actually stick around or jump ship the first chance they get. Section 4, Improving Patient Health Outcomes, the Value of Wellness. Here, the framework explicitly links the physical health of the patient to the enterprise value of the managed care entity. It's simple math. Better health equals fewer massive medical claims, which leads to improved margins. But how do you actually measure that effort? Well, the HCMC standard mandates that entities track and disclose the percentage of their enrollees participating in specific wellness programs. And they have to break this down into 6 distinct categories: diet and nutrition, exercise, stress management, mental health, smoking or alcohol cessation, and other programs. This tracks primary prevention, keeping people healthy through things like immunizations and exercise, and secondary prevention, which is all about early disease detection. If a health plan isn't actively investing in these specific wellness categories, they are severely falling behind in mitigating their long-term medical costs. Section 5, Climate Change Health Impacts, Environmental Risks to Human Health. When we think of climate change, we usually think of the energy sector or agriculture, right? But the HCMC framework dedicates an entire section to climate change impacts on human health, building a cascading risk profile for health insurance companies. The standard outlines a very direct chain of events. An increase in extreme weather and climate shifts leads to the geographic migration of diseases. For example, tropical vector-borne diseases like malaria and dengue fever are now moving into previously non-tropical regions. This shift leads to increased morbidity and mortality in entirely new populations, which directly translates to a massive surge in unexpected medical encounters and higher claims for the insurance provider. So climate risk is quite literally a financial healthcare risk. The standard goes as far as requiring companies to explicitly discuss their strategic business approach to addressing these significant risks. They must detail exactly how changes in the geographical incidence of illnesses are being incorporated right into their risk models. They even have to factor in things like increased waterborne diseases, such as cholera outbreaks following natural disasters, and higher rates of malnutrition from decreased global food availability. A truly sustainable managed care entity in the 21st century absolutely must have a climate-adapted risk model. To sum this all up, what the SICS code SHMC-MC does is actually pretty remarkable. It takes all these abstract environmental, social, and governance concepts and transforms them into concrete, strictly trackable metrics, specifically tailored for the managed care industry. From counting the exact number of reversed medical claim denials, to measuring the painful financial fallout of data breaches, to forecasting the spread of malaria, it provides a totally transparent map that shows exactly how a company protects its enterprise value by protecting its patients. So I'll leave you with this final thought to consider the next time you're looking at your own health insurance provider. If a health plan isn't tracking their data security, if they aren't actively reversing incorrect claim denials, and if they aren't modeling for the changing health of our entire planet, are they truly prepared to protect yours? Thank you so much for joining me for this explainer, and keep asking the tough questions.